So thank you very much for joining us today, Alastair. Perhaps if we start off the questions just with what is currently known about the relationship between Parkinson's and type 2 diabetes.
Thanks, Simon. So, I mean, I come at this from two places. One, from a clinical perspective, and what I've seen in my movement disorders clinic in East London, and then also from an epidemiological perspective, which is my kind of research interest. So, from an epidemiological perspective, we actually first looked at the link between type 2 diabetes and Parkinson's about 10 years ago in a big systematic review and meta-analysis that I led and was published in the Annals of Neurology in 2012. But at that time, we looked at a whole load of different risk factors for PD, diabetes being one of those. And that analysis was kind of buried in figure 4, along with the other things that overall showed no obvious effect on PD risk. But actually taking a closer look at that, it was quite interesting. So broadly, there are two main types of observational study in epidemiology. There's case control studies and cohort studies. And actually, if we take a closer look at that analysis that we did back then, the case control studies appear to show a protective effect, and the cohort studies appear to show a detrimental effect in that people with type 2 diabetes may be at slightly higher risk of Parkinson's disease. And then we looked at this in closer detail last year in another systematic review of meta-analysis published in Movement Disorders. And what we showed is that the highest quality observational studies tend to overall show a detrimental effect of type 2 diabetes on PD risk. And actually poorer quality studies are the only ones where you see a null effect or an inverse association. So what's going on there? Well, I think one of the reasons we see that is because you can get a phenomenon called survivor bias in case control studies. And so with case control studies, you start with people that have Parkinson's disease and don't have Parkinson's disease, and then you look back in time to see whether, in this case, they had type 2 diabetes. Now, if a condition or an exposure is associated with an increased risk of death or mortality, then you can get a spurious protective effect in that situation, because the people with type 2 diabetes wouldn't have lived long enough to get Parkinson's disease. So we think that's what's going on there. We extended that analysis using a method called Mendelian randomization, which can support the observations made in observational studies, in epidemiological studies, and again found evidence to support the fact that type 2 diabetes may increase the risk of Parkinson's. And then taking that further, we started to look at what evidence there was that type 2 diabetes may not just only increase risk of PD, but also PD severity in terms of motor severity and also cognitive severity. And the project that Cure Parkinson's has funded now is going to allow us to look at this in further detail. I just would touch on also, I mean, I'm not a basic scientist, but there's accumulating evidence from the basic science space that suggests that there are overlapping pathways between type 2 diabetes and neurodegenerative disease. Insulin itself may be neuroprotective, but then there are also overlapping pathways around aggregation of misfolded protein and failure to clear that protein from cells, mitochondrial dysfunction, neuroinflammation. And then the final piece of evidence I think that we've seen in the last few years is that drugs repurposed from for the treatment of type 2 diabetes, repurposed for Parkinson's disease, appear to be showing an effect. A study led by Professor Fultony and Dylan Athauda at UCL, that I think was in part funded by Cure Parkinson's, showed that exenatide, which is a treatment for type 2 diabetes, when given to patients with PD, improved their motor symptoms, and that those effects persisted even after a washout of the drug. So I think we're seeing multiple lines of evidence converging to suggest there's something going on between type 2 diabetes and PD.
Wonderful. And speaking of the funded project, could you explain or just briefly summarize what exactly you're going to do?
Sure. So it's really divided into two parts, and I think there have been lots of studies looking at the effect that type 2 diabetes might have on risk of developing Parkinson's. And there's been far fewer studies looking at the role that type 2 diabetes might have in terms of driving PD severity in people that already have PD. And so this project funded by Cure Parkinson's is really looking at that in two different ways. The first way is to analyze data from a variety of different studies, one of which is our own East London Parkinson's disease project, but also other national cohort studies like Tracking Parkinson's, the Oxford Discovery Project, and then some of the North American studies like PPMI, the Harvard Biomarkers Study, and the Parkinson's Disease Biomarkers Program, PDBP. And basically bringing together data from all of those different studies, so several thousand patients, several thousand controls, to look at how having type 2 diabetes may affect the severity of the manifestations of PD in terms of motor and non-motor symptoms. And where possible, looking at how type 2 diabetes may move age of onset of Parkinson's earlier, and also, again, where data are available, looking at how type 2 diabetes might drive faster progression. So not just the cross-sectional severity of PD in people with diabetes, but also how it may drive faster change over time. So that's the data side of it. And then the other side of it is a biomarkers project. If we believe that type 2 diabetes really worsens PD severity, then we might see that reflected in certain putative biomarkers for PD. So we're interested in neurofilament, for example, and markers of inflammation that we can gather from the blood, and relating those to having type 2 diabetes or not in PD patients, or markers of diabetes severity in those same patients. So those are the main two angles.
Excellent. This is really awesome. So you've established a East London cohort for the study, and you're also going to be looking at another cohort. Why is the East London cohort of interest, and what are the other cohorts that you'll be looking at?
Yeah, so first of all, East London, irrespective of the research question, is a great place to do research, because like most research into complex disease, the research that has taken place in Parkinson's to date has tended to recruit patients from white, affluent, well-educated populations. And so the population of East London is diverse in terms of ethnicity, and generally about 50% occupy the lowest quintile of wealth in the UK. In general, it's a population that has not been well represented in research, so it's a great population to recruit from. But when it comes to the question about the relationship between type 2 diabetes and Parkinson's, that's where I think there are real opportunities. So of the people that we've recruited so far to the East London project, about 35 to 40% have type 2 diabetes, and that's compared to the usual prevalence of diabetes in patients with PD in other cohorts, which is less than 10%. So it's very much enriched for our exposure of interest here, which is type 2 diabetes. But yeah, we're recruiting from East London, but we're also gathering data, or sharing data, I should say, from Tracking Parkinson's, which is nationwide PD cohort study, from the Oxford Discovery Project, also from King's, from Professor Chowdhury's group there, which is also very diverse, but with a different demographic to that we have in East London. A Swedish cohort as well, based out of Lund, and then some of the North American studies, PPMI, PDBP, and Harvard Biomarkers study. So we're hoping to bring together data from several thousand patients and several thousand controls, and look at how type 2 diabetes may affect PD severity.
Thanks, Alastair. So for the biomarkers side of things, can people who are not part of this cohort, who have Parkinson's and diabetes, also get involved, or is it strictly people who are already involved in those cohorts?
Yeah, well, so if people have have Parkinson's disease and are residing in East London, then hopefully they're already taking part, or we've already approached them. And if we've not, then please do get in touch, because we'd love to hear from them. And people who are participating in the Oxford Discovery Project and tracking and King's study, if they are already taking part in those studies and have consented to data sharing, then hopefully we'll be using their data in this. The project is really focused on using data that is already available and gathering some biomarker samples for biomarker analysis from East London. So if you live outside East London and you want to take part at the moment, we can't do that, but I hope that this will lead on to further studies looking at this relationship, and then yes, we'd love to involve more people.
Brilliant, thank you. And how is the project going at the moment, and when do you envisage results being available?
So, I mean, all things considered, in January 2022, it's a clinically facing project. I think things are going pretty well. This was a one-year project that we kicked off in August 2021, and I'm hoping that we will have results by August 2022 that we can analyse and write up by the end of the year. In terms of specific progress, we've signed agreements for most of the cohorts that we want to analyse the data from, and we're just waiting for that data to be transferred. That analysis will be taking place over the next 6 months, done by a senior statistician in our group called John Bestwick, who I've worked with a lot on various analyses that we've done from the preventive neurology unit. The biomarkers work is underway, so we've already collected samples from about 50 patients with PD and about 35 controls. So we're looking for, in total, 60 patients with type 2 diabetes and Parkinson's, 60 patients with Parkinson's that don't have type 2 diabetes, and 60 controls. So I think we're making good progress there. And so, yeah, I hope that we will have all of the data and samples collected by August and have some results for you later in the year.
That's brilliant. And so how will the results potentially benefit clinical trials and potentially participant selection for trials?
So I think in several ways. So the first thing to say is that I think our results may guide our management of patients with Parkinson's disease more generally, including those that have type 2 diabetes or borderline type 2 diabetes. If we see a strong relationship between having type 2 diabetes or impaired fasting glucose and Parkinson's severity, then I think that will probably change our practice in the movement disorders setting, where we will actually be looking for type 2 diabetes and screening for it and wanting to treat that quite aggressively. I bet most neurologists who are looking after patients with PD probably aren't thinking that much about diabetes, but it's very common. And so I think if we do see a relationship, that may change our practice. I suspect the geriatricians who are looking after patients with PD probably do it much better than the neurologists. The second thing is I think it will help us in terms of the pursuit of repurposing drugs for Parkinson's disease and the prospect of disease modification. I've mentioned that some of the agents in which we're placing the most hope to modify the clinical course of PD are drugs that are repurposed from the type 2 diabetes space, and I know CP has a big interest in these agents as well. So I think it will help inform some of those studies, and also may identify subgroups of patients with Parkinson's disease who may benefit most from those drugs. And in that way, we'd be taking steps towards precision medicine, targeted treatment for subgroups of patients. And then I think on a local level, we will be identifying patients who potentially could go into those trials, okay, a subgroup who might be a trial-ready population for further trials. That's my hope. And then the last thing is more of a prevention angle. So, this as an epidemiologist, this is a big interest of mine, and we are told that the prevalence of Parkinson's is increasing around the world faster than any other neurological condition. And I think on one level we have to critically appraise that. But if that is true, then one has to ask why that is. And even though the relationship between type 2 diabetes and Parkinson's is fairly modest, the burden of type 2 diabetes is going up around the world and could be part of the reason why, if there is a big increase of PD, that's happening. So I think there are opportunities for prevention of PD if that link is robust and true and part of driving that increase. So I think on many levels can help us.
Thanks, Alastair. That's all really exciting, and we look forward to hearing the results, hopefully later this year.